And I remember during the ultrasound, the tech got really quiet around when she was taking pictures of her spine. But we didn't really think anything of it at the time. She said she was just having trouble with Peyton's position, trying to get good pictures. So we left after that. I had some labs done, and then she came back in and pulled us aside and said, you know, the doctor needs to talk to you about some things. And again, didn't really think anything of it. But as soon as the doctor walked into the room, I think both of us just knew that this isn't right. This is not how the ultrasound's supposed to go. And I think it just kind of was a blur from there. I heard the word spina bifida. I'd heard it before, but I didn't really know what it meant. I knew most kids couldn't walk with that. That's about the extent that I knew. So it was really difficult. It was a hard day.
Yeah, when I found out about spina bifida, I had never heard of it. I couldn't pronounce it, and I sure as heck couldn't even spell myelomeningocele, the official terminology. So I went to Google and was reading a lot of different scary things about it, about the fact that your child isn't going to be able to walk, that they're going to have difficulty going to the bathroom. Their intelligence is going to be a few points below that of any of their siblings, and that their quality of life is going to be pretty low. It was all pretty grim. The spina bifida community has been instrumental in, I think, us being able to move forward with Peyton and being able to maintain a positive outlook for her. We could relate to other people. People knew what we were going through, and when they gave us advice, it was something that you could rely on. It wasn't just kind of the wishful, oh, I hope everything goes okay, right, that any other normal family member would say to us.
So when we left her first appointment at the ultrasound, they had referred us to maternal fetal medicine. So they hadn't said anything. They said it looked like it was spina bifida, but there's many different types of it, so they weren't able to see what it was at the time. So we saw them a couple days later. They were able to get another ultrasound of her, and they said it was the most severe type of spina bifida. They said she was about L5S1, so they kind of gave us an idea of what her life would look like. They said walking may or may not be a possibility. Bowel and bladder, she would never have control over that. There might be some cognitive delays. So they kind of went over the options with us. One was postnatal surgery, which most people do, or fetal surgery. We could see if we could qualify for that, and then she said abortion if we asked her. Obviously, that one was like a punch in the gut to hear. It was very painful to hear that, but we knew it wasn't an option for us. So.
It was a long journey for us to get pregnant the first time. It took us almost 2 years of trying. We were considering in vitro, and when we found out that we were pregnant with her,
we knew she was already a miracle, so just the thought of even aborting her.
There was never an option for us. Yeah. I don't have a medical background. I didn't know what a lot of this stuff was. The biggest scare that I had this past year was cathing. So the urologist decided that we needed to move forward with cathing for Peyton. And I almost fainted the first time that I had to cath her. I was just terrified of doing it. Bobby is a nurse, and so she has a little bit more medical experience than I do. And she had to do it for a few days before I could get the nerve to actually cath. And now it's just part of our routine. I do it every day, multiple times a day for her, and I don't think anything of it. And so,
part of her normal life now.
Yeah. Peyton has had to have a shunt revision a few months after she was born, and that was a very scary experience, but we went through it, and we're prepared now. The information that I'd like to share with families that have found out that maybe their child's going to have spina bifida, we call it Diagnosis Day in the community, is, yeah, that's going to be scary, and the unknown is very scary, but it only gets better from there. Diagnosis, and then going through the uncertainty. The pregnancy, that's basically the scariest part. And then you're going to go through the NICU, and those 2 weeks are going to be pretty scary as well. And after that, when your child gets to go home with you, all of those fears are gone because now you've got your baby and you've got your family. And for me, I barely even remember what that anxiety was like, because now I have my daughter. The hopes that we have for Peyton is that she lives a very fulfilling and happy life. Spina bifida is a part of her, but it does not define her. She already has proven so many doctors wrong, based on the outlook that they gave us, based on what Dr. Google gave us. Peyton is a miracle in our eyes, and she is a reminder of what God can do, answering prayers. Like I said before, we have leaned on a lot of the SB community for support and assistance, and asking how do you get through these moments? And a lot of it is just, we're here for you, Hutson family. We know exactly what you're going through, and if you just need anybody to vent to or cry with, or if you need anything at all, let us know.